Good afternoon. In today's presentation, it will preview our healthcare and the importance of our basic structures and the essential services as they all come together to empower, educate, and enlighten a great quality of care for our patients. Our healthcare today is riddled with so many hurdles. Our patients are growing older and increasing in numbers. Our healthcare expenses are considered some of the most expensive in the world. Our government is changing the whole entire system of healthcare. So we must focus even more today on the essential services that are the baseline of our healthcare providers, providing the quality of care that our patients deserve. Today, the presentations will be covering a range of topics, including our public and community healthcare, our legal and ethical challenges to the funding of healthcare, and healthcare organizations as a whole. The role of community health is to reduce the burden of chronic disease and achieve health equity. Communities must create momentum that assists people in making healthy choices where they live, learn, work, and play. We must choose sustainable changes that address the major risk factors. We must provide the priority mission of collaborating with citizens for education and empowerment of the support systems. One of these systems created was our CDC, which has created a healthy community program. This works through local, state, and territory and national partnerships to improve community leaders and stakeholders, provide skills and commitments for establishing, advancing, maintaining the effective population-based strategies that come up through emerging infectious diseases, obesity, and other risk factors of health. The focus and the role of public health is to provide interventions to improve health and quality of life to the prevention and treatment of disease and other mental and also physical health conditions. They do this through the surveillance of cases and the health indicators of our society. They work in structures of breastfeeding, vaccinations, STDs are just examples of common public health measures in our society today. Some of the quick steps the public health model does is define the problem. They must identify risks and protective factors. They develop and test prevention strategies. And lastly, they assure the widespread adoption of any interventions or solutions to concerns in our society. One of the last roles of public health is becoming responsive to the disasters that assist communities. Their role in this is imperative to ensuring that a disaster scenario can mitigate somebody's physical, mental health being quicker and more efficiently. Our public health structure is made up of a web of processes and entities that all compile a broad spectrum of health understanding. The structure includes the family, the individual, our communities, and the public health and community health systems, or the system management. With this, there are multiple variables of systems for checking the measures that are being met. These variables include the assessment, in which we monitor, investigate, then provide. Then you have the policy development, in which policies and interventions are created and implemented. And lastly, one of the biggest sides is the assurance, is to be performed and enforced, to link our systems together and ensure and evaluate the results the processes of the public health structure. In our healthcare world today, we must understand to mobilize. We must communicate to empower. Our healthcare systems need to unify and collaborate our systems and must communicate effectively to reduce the negative impact that poor communication or misperceptions of poor communication can have on a healthcare system. We must remember to acknowledge the barriers of culture, intellectual and environmental, and the physical barriers to allow to prepare for the appropriate method of communications. To understand communication is to understand we must present it well. We must approach well to communicate well. We must understand we can utilize our persuasive communication skills, our educative communication skills, or lastly, if we need to do a new approach, we need to use mass communication. Mass communication is usually utilized for the public health systems to handle their sheer numbers needed to be hit. We must still remember and stay cognizant of those barriers, because barriers to communication are everywhere in our healthcare systems. Our legal and ethical healthcare concerns, some of them would be legal and ethical. Enforcing our healthcare laws and ethical responsibilities is a daunting task. One of the organizations that does this or laws that does this is called HIPAA. This law protects the patient's right to disclose of health information. This is interesting. Even though it protects the rights of the individual, it is very balanced to ensure that appropriate uses and disclosures of information may be released to protect the nation's public health and for other critical uses. Other ethical responsibilities are to provide the decisions to be advocates for our patients and allow our patients to have full autonomy. Some of our agencies that oversee laws and ethics in our society choose to oversee and implement enforcement when needed. But with so many factors and technologies changing today, our ethical and legal processes will always be evolving to handle some of the biggest ethical and legal concerns. One of these concerns I would like to broach is infectious disease decisions. Is quarantine legal? According to Article 42, the regulations to control communicable diseases, this amendment to the Constitution is legal for practice of isolation and quarantine if deemed a public health crisis or confirmed disease that's listed on Title 42. So remember, we do have rights as citizens, but sometimes these rights are trumped for the betterment of our society. In our healthcare funding today, it has drastically changed, especially with the enactment of the Affordable Protection Act, or aka Obamacare. Our society has been spending the most in the world on healthcare monies. With this, our healthcare spending numbers are indicated to have increased to 3.7% to $2.8 trillion, or $8,915 per person. With such staggering numbers, these numbers are actually a good sign, with 2012 being the fourth year of slow growth. Our healthcare spending has decreased from 17.3% to 17.2%. These numbers do show some good news for our spending for the future. One of the biggest funding processes of our healthcare today is the Medicare and Medicaid program. The Medicare program is the second largest social insurance program in the United States, with 52.3 million beneficiaries and total expenditures of $583 billion in 2013. With healthcare funding, we must remember that private insurance and grants are a huge composite of healthcare funding. In 2009, Obamacare created the Community Health Center Act, which allocated $9.5 billion to support community centers, to expand the preventative and primary care services that are needed. This act also increased the number of patients being taken care of by community centers by almost 5 million people. This is 21.7 million people annually being taken care of. Some of the major funding of healthcare also comes from private insurance premiums, which reached $917 billion in 2012. This did increase at 3.2%. With private insurance, we must remember there's also out-of-pocket. Out-of-pocket spending has also grown to 3.8% to $328 billion in 2012. One of the concepts of funding is also knowing where funding and the concerns of funding are coming from. With Obamacare, Medicare fraud recovery became a paramount process. Federal efforts did today combat healthcare fraud and recovered a record $4.3 billion in fiscal 2013. They have recouped more than $8 for every $1 spent on enforcement over the past 3 years. With our healthcare funding, we must remember we must become more efficient and more cognizant of how expensive our healthcare is. So, in today's presentation, we have surfaced many aspects of our healthcare systems. The presentation covered the financial services and sources of our healthcare systems, some legal and ethical systems concerns, and the enforcement of them. As we lightly delved into the healthcare spectrum, this presentation reminds us to stay present and proactive in our struggles and successes in healthcare and the systems that support it. Our patients are the core of our healthcare, and they deserve the highest in quality of care that our essential services can give them.